Yesterday, there were 7,108 new cases. However, there are also early signs that the actions that we've collectively taken over the past month are starting to have a positive impact. Today's REACT study from Imperial College suggests that whilst the R number remains above 1, there are early signs that it may be falling. We must not let up, but people everywhere can take some small hope that our efforts together may be beginning to work. I put it no stronger than that. Cases are still rising. However, as the Chief Medical Officer set out yesterday, this second peak is highly localised. And in some parts of the country, the virus is spreading fast. Our strategy is to suppress the virus, protecting the economy, education, and the NHS until a vaccine can make us safe. Earlier this week, Mr. Speaker, we brought in further measures in the North East. However, in parts of Teesside and the northwest of England, cases continue to rise fast. In Liverpool, the number of cases are 268 per 100,000 population. So together we need to act. Working with council leaders and the mayors, I'm today extending these measures that have been in place in the North East since the start of this week to the Liverpool City region, Warrington, Hartlepool and Middlesbrough. We will provide £7 million of funding to local authorities in these areas to support them with their vital work. The rules across the Liverpool City region, Warrington, Hartlepool and Middlesbrough will be as follows. We recommend against all social mixing between people in different households. We will bring in regulations, as we have in the North East, to prevent in law social mixing between people in different households in all settings except outdoor public spaces like parks and outdoor hospitality. We also recommend that people should not attend professional or amateur sporting events as spectators in the areas that are affected. We recommend that people only visit care homes in exceptional circumstances, and there will be guidance against all but essential travel. Essential travel, of course, includes going to work or school. Mr. Speaker, I understand how much of an imposition this is. I want rules like this to stay in place for as short a time as possible. I'm sure we all do. The study published today shows us hope that together we can crack this. And the more people follow the rules and reduce their social contact, the quicker we can get Liverpool and the North East back on their feet. We're also aligning the measures in Bolton with the rest of Greater Manchester, and I'd like to pay tribute to David Greenall, the leader of Bolton Council, for his constructive support, and the Bolton MPs for all they've done in support of Bolton. There are no changes to measures in West Yorkshire, West Midlands, Leicester, Lancashire, or the rest of Greater Manchester. It is critical that the whole country acts together now to control the spread of this virus. So please, for your loved ones, for your community and for your country, follow the rules and do your bit to keep this virus under control. Mr. Speaker, by its nature, this virus spreads through social contact, and so it's had a terrible impact on the hospitality sector, who in good times exist to encourage that very social contact that we all enjoy. So we've had to take difficult but necessary decisions to suppress the virus. The only alternative to suppressing the virus is to let it rip, and I will not do that. So whilst I know that many of the individual rules are challenging, they are necessary, and there are those early signs that they're working. In the measures we've introduced, including the 10 p.m. restriction, we're seeking to strike a balance, allowing people to continue to socialise safely where that's possible, while reducing the social contact that the virus thrives upon. Elsewhere in the world, they've introduced an evening restriction and then seen their case numbers fall. And we know that later at night, people are less likely to follow social distancing. Now, of course, we keep all our measures under review and we'll closely monitor the impact of this policy, as with all the others, while continuing our unprecedented support for hospitality businesses, like cutting VAT, support for the pay of staff, offering rates relief for businesses and giving billions of pounds of tax deferrals and loans. Mr. Speaker, our hospitality industry provides so much colour and life in this country, and we will do whatever we can to support them while acting fast to keep this virus under control. I know that these measures are hard and that they are yet another sacrifice after a year of so many sacrifices already. But there are some signs that what we're doing together to respond to these awful circumstances is starting to work. So don't let up. Let's all of us keep doing our bit, and one day, over this virus, we will prevail.
Thank you, Mr. Speaker. And I thank the Secretary of State for advanced sight of his statement. The Imperial study today is indeed encouraging, but as the CMO said yesterday, we have a long winter ahead. Now, we know that sustained contact, especially in crowded, poorly ventilated spaces, is a driver of infection, and pubs and bars are an obvious risk. So I heard what he said about the 10 p.m. rule, but my concerns relate to everybody leaving the pub at the same time. So what action will he take so we don't see a repeat this weekend of people piling out into city centres, packing out public transport, sometimes all piling in to a supermarket to buy more drink? Now, we on this side completely understand the need for local restrictions, including in Merseyside, as he has just announced. I think it was probably too late for colleagues from Merseyside to get onto the call list this morning, but I think if they were here, they would be keen to press the Secretary of State further on the financial support for Merseyside. This is a region which is hugely reliant on hospitality and leisure, and we know that these restrictions extract a heavy social and economic toll, and so areas need financial support. Otherwise, existing inequalities, which themselves, of course, have a health impact and allow the virus to thrive, will be exacerbated. People need clarity as well. Areas like Leicester, Greater Manchester, West Yorkshire, Bradford have had restrictions imposed on them for months now. Millions of people in these local lockdown areas, like across the North and Midlands, just need some reassurance that an end is in sight. Many want to know when they'll be able to visit their loved ones. Many want to know whether they'll be able to visit their family over the coming school half-term, for example. Can he just confirm, has he now ruled out the so-called circuit break taking place across the October half-term, as was mooted in the newspapers last week? Also, some of the heaviest increases in infection appear to be taking place in areas where restrictions are in place. So why are the interventions not working? Why are the moles not getting whacked? Yesterday, the Prime Minister suggested that the success of Luton in leaving restrictions was because of people pulling together. But I've got no doubt that people are pulling together across Bolton, Bury, Rosendale, etc. So what additional help will they receive to drive this virus down? Now, I believe ministers lost precious ground in fighting the virus by not having an effective test, trace and isolate regime in place by the end of the summer. Testing and tracing is key to controlling the virus. Increasing evidence now shows that the importance of backward contact tracing in controlling outbreaks. So could he tell us, is backward contact tracing routinely happening in areas of restriction, and will he publish data on backward contacts reached? Now, we support the calls from the Health Select Committee today for routine testing of all NHS staff. Will he finally set a date for introducing it? But problems do remain with testing generally. I've just heard of a case in the Rhondda where people have turned up at a testing centre, have booked appointments, but Serco has pulled the testing centre out. And Serco are saying in that area they need the Secretary of State to intervene if that testing centre is to be reopened. Will he do that? Now, on the 8th of September, he told the Select Committee that the problems with testing would be resolved in the coming weeks. That was more than 3 weeks ago. Yet a test still takes 30 to 31 hours to turn around for in-person tests, 75 hours for home test kits, 88 hours, more than 3.5 days, for test results in the satellite test centres, which are predominantly used by care homes. So he hasn't resolved the problems. When will we? And today, we've learnt that Deloitte, who are contracted by the government to help run Test and Trace, are now trying to sell contact tracing services to local councils. So the government-owned contractor, one of the very firms responsible for the failing system in the first place, now sees a business opportunity in selling information and services to local authorities. They should be getting this anyway, and this is in the middle of the biggest public health crisis for 100 years. Isn't this an utter scandal? How can it be allowed? Doesn't it once again show that directors of public health should be in charge of contact tracing? And finally, Mr. Speaker, this week GPs warned of significant problems with flu vaccine supplies. Boots and Lloyd's Pharmacy have stopped offering flu jab appointments due to issues with supplies. Can he confirm that we have enough flu vaccines available for all who will need one this winter?
Thank you very much. Well, I welcome his support for the measures that we've had to take, and the £7 million of extra financial support for the councils who are affected, not just Merseyside and Holton and Warrington, but also in Hartlepool and Middlesbrough. That's on the same basis as the support for the North East 7 councils that was announced at the end of last week. It is true that some parts of the country have come through a local lockdown. In fact, we've lifted many of the measures, for instance, that were in place in Leicester. We weren't able to lift all of the measures, and the case rate there did then go back up again, although it has now appeared to have stabilised. And Luton is another example where there was a very significant local outbreak, which was brought under control. He asked about increased testing. There is, of course, increased testing going into to Merseyside, and we can do that because we have a record capacity which has increased yet again this week. He asked about backward contact tracing. Absolutely, we have backward contact tracing in these areas. One of the reasons that we know, sadly, that the highest area of likelihood of picking up a case of coronavirus outside your own household is in social settings is because of backward contact tracing. So there's further information that Public Health England will be publishing today on further work on backward contact tracing to understand how this virus spreads. He asked about the speed of test results. I'm glad to say that the speed of the turnaround of test results in care homes is speeding up. He asked about Deloitte and their contact tracing capabilities. Deloitte have done an incredible job in helping us to put together the contact tracing and the backward contact tracing that we have. And of course they should offer their services to local councils too. On the one hand, he says local councils should have more impetus and more involvement in the contact tracing. And then when a company with great experience in contact tracing comes forward to offer their services, he criticises them. I mean, they can't have it both ways. And of course, these services cost money and they have to be delivered. And I pay tribute to Deloitte, who are doing such a brilliant job. Finally, he asks about flu jabs. And it is absolutely true, as he says, that there is a record rollout of flu jabs. There are enough flu jabs for everybody who needs them in the priority group. I would stress that this is a rollout. Nobody needs to have a flu jab before the start of December. You can have it in September or October. It will then cover you for the winter. And so we are rolling it out, and more appointments will become available in good time. We've got 30 million jabs in total. That is more than we've ever had before. It's almost double what we've typically had in the past, and those are available. I'm really glad to say, Mr. Speaker, that record numbers of people are coming forward to get flu jabs, and I welcome that. But people, as the Royal College of GPs have said, people will have to have patience. They will, if you're in the group, the target group, the over 65s and those with clinical conditions, there are flu jabs available, and it will take us the coming weeks in order to make sure that the people who need those flu jabs can get those flu jabs.
Bradford's been in a local lockdown for weeks and weeks, and the number of cases are going up, not down. But is the Secretary of State aware, Mr. Speaker, of the damage the arbitrary 10 p.m. curfew is doing to pubs, restaurants, bowling alleys and casinos? Is he aware of the jobs that are being lost, all just to see people congregating on the streets instead and shop staff getting more abuse? When will the Secretary of State start acting like a Conservative with a belief in individual responsibility and abandon this arbitrary, nanny state, socialist approach which is serving no purpose at all apart from to further collapse the economy and erode our freedoms?
Thank you very much, Mr. Speaker. I'm going to pay tribute to my honourable friend. And the reason is this. There are some people who rail against some of the measures that we have to put in place. And of course I understand the impact that they have. And there's reasons for each one of them. But collectively, they're vital for the strategy that we're pursuing of suppressing the virus, protecting the economy and education and the NHS until a vaccine arrives. My honourable friend doesn't agree with that strategy. And I think that's a perfectly honourable position. It's just something I profoundly disagree with him on. And he, indeed, last night was one of the handful of colleagues who voted against the renewal of the Coronavirus Act. So it's perfectly reasonable to make the argument that we should just let the virus rip. I just think that the hundreds of thousands of deaths that would follow is not a price that anyone should pay. I believe in individual responsibility and that in promotion of freedom, subject to not harming others. And one of the pernicious things about this virus is that people can harm others and sometimes inadvertently can harm them in such a way by giving them a disease that leads to their death without even knowing about it, because this virus passes from one to another asymptomatically. So while I, especially myself coming from a small business background, I understand the impact of these things. I get it. But unfortunately, we do have to take action to suppress the virus, because the alternative of letting it rip is not a policy that I would ever want to pursue.
Let's head up to Scotland with SNP spokesperson Martin Day.
Thank you, Mr. Speaker. It's vitally important that we find a balance between taking action to suppress the virus and protecting people's jobs and their livelihoods. How confident is the Minister that the existing rules within pubs and restaurants on hygiene, face coverings, table service, maximum numbers within groups and the distances between them are being complied with? And what happens next if they're not? Does the Minister agree with me that avoiding mixed messaging is particularly important? So what message does it send that Parliament's bars are exempt from the curfew? And will he commit to continued cooperation with the devolved governments under the four-nation plan?
Mr. Speaker, I haven't been to the bar recently, but I do not think that the Parliament's bars are exempt from these measures, and I think it's wrong to say so. And I'd be very grateful if you could confirm that, Mr. Speaker, because it is a matter for the House, not for the government. What I'd say is to the honourable gentleman is that other than that point, he makes a perfectly valid point. Of course we keep these measures under review. We want to have the least damaging economic impact consistent with bringing the virus, keeping the virus under control and suppressing it. That's the same strategy that's carried out across all four governments, the three devolved governments and the UK government. It is the same strategy. So yes, we keep these things under review, but we do think that they are necessary in order to keep people safe.
I will confirm, because I think it's, if the honourable member had been in the House, he would have realised, or if he'd spoken to his colleagues, the decision was taken last week. Unfortunately, the newspapers were mischief-making. Those bars were not open after 10 o'clock. Let's get that clear. And I think we ought not to believe sometimes what newspapers say. Right, let's move on to Brendan Clark-Smith.
Mr. Speaker, the government's already made more than £190 billion in support available to protect both lives and livelihoods. And last week I spoke to Tom and Lindsay, the landlords of the Columba Inn in Ordsall, to discuss the impact that these lockdown measures are having on the hospitality industry, which I know my right honourable friend understands. So can he confirm that ministers will continue to work closely with the sector to look at what further support can be provided for them?
Absolutely, and I think if I spot it correctly, the honourable member is wearing the Parliamentary Beer Association tie. So he obviously knows that of which he speaks. But he's right, he's made a very important and very serious point, which is that of course we'll keep working with the hospitality industry and we'll do everything we can to support them through these times. It is so difficult because of the way that the virus spreads. Therefore these measures are necessary. We haven't gone for a full-blown lockdown in March. That's because we know far more about the virus because of the test and trace system and because of the massive amount of testing that we're doing and the contact tracing. That does mean we could be more targeted, and my heart goes out to everybody in the hospitality industry who's doing so much.
Daisy Cooper with 2 minutes, as it was the UQ that I've converted.
Thank you, Mr Speaker. As the House will know, the original urgent question was about the 10 p.m. pubs curfew, and it is clear that after this statement, the government is simply not listening. It seems to be covering its eyes and ears and singing la 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 la. You say that this is under review, but where is the evidence? The evidence is clear. The 10 p.m. pubs curfew has been a hammer blow to hospitality, and turfing crowds of people out of COVID-secure venues onto the streets is putting lives and livelihoods at risk. Since reopening in July, Mr Speaker, businesses on every single one of our high streets have put blood, sweat and tears into making their venues COVID secure, but they are trading at a reduced capacity. And now with this pubs curfew, some of them have seen a reduction by a further 50%. The Prime Minister announced this blanket 10 p.m. closing time just last Tuesday. Within hours, the industry warned that it would lead to chaos on the streets, and it did. The shocking truth is that this government has, by its own admission, made no assessment of the cost of this measure to the industry. And Sage has confirmed that it was never even consulted on whether a 10 p.m. curfew would be effective. Now experts are telling us that it's making the risk of COVID transmission worse. Public Health England's weekly surveillance reports are clear. Outbreaks of the virus in hospitality venues are responsible for less than 3% of all cases, and they have not contributed to any of the increase. And yet this government is making thousands upon thousands of hospitality jobs unviable, undermining public health and killing our high streets. The government likes to talk about balance and tough choices that it has to make between public health and the economy. But the shocking truth is that the pubs curfew is bad for both, and the longer the government defends it, the more damage it will do. Mr Speaker, people are scared. Care homes are becoming prison-like, students are being locked up, and businesses are saying that without a further package of support, they will... Mr Speaker, people are scared. Care homes are becoming prison-like, students are being locked up, and businesses are saying that without a further package of support, they will be closed by Christmas. I asked for some evidence behind this measure. He has provided none, and that is why this curfew must be scrapped today.
Secretary of State.
Thank you very much, Mr Speaker. I just want to correct the Honourable Lady on the point that she made about outbreaks. The measures of which the updated statistics will be published today by Public Health England, the measures that have led us to understanding the virus spreads most outside of households when other households meet together, including in hospitality venues, comes from the very backward contact tracing that the honourable member on the front bench for the opposition asked about. The outbreaks data is about where there is an outbreak with significant numbers within one institution, not where individuals go to. So, for instance, within a care home or within a school, where that is then raised as an issue with Public Health England. So I'm afraid she's using a different set of statistics which do not make the case that she puts forward. Where, of course, we all understand the concern is the impact of this virus on so many parts of our economy, and our task is to try to limit the impact on lives as well as on livelihoods, and that's at the root of our strategy.
Alberta.
Thank you, Mr Speaker. My city has been following the rules. Thanks to the people of Peterborough and excellent council leadership, we have come off the watch list last week. Now, I know data can change, and I also know that my right honourable friend appreciates the issues around the 10 p.m. curfew. But will he keep this policy under review so that those who are doing the right thing, like the people of Peterborough, can get back to something like normality?
Absolutely, Mr Speaker. And my honourable friend is an incredible voice for Peterborough. And when we discussed local lockdown having its effect in Leicester, and the Prime Minister mentioned Luton yesterday, the work of the people of Peterborough is another example that we could cite. And my honourable friend from Shipley shouts from the sedentary position, what about Bradford? The truth is we did take Shipley out of the measures because the numbers came right down. Unfortunately, they then rose again. So in a way, he makes my point for me.
We're now heading to the member for Huddersfield, Bury Sherman. Bury Sherman.
Thank you, Mr. Speaker. The Secretary of State knows that I can get passionate and even angry with some of my questions to him, but not today. He will know as a West Yorkshire MP, I will support anything, any measure that stops this virus spreading at this perilous term when tens of thousands of students are moving around our county and our country. And so I would support any measure that is effective. But when I say the old social scientist in me suggests that he's right when he said all these measures should be closely monitored. And there's no doubt, whether it's Professor John Edmonds and other experts, worry that the 10 o'clock curfew has unintended consequences that are quite serious. Will you give me his word that he will keep it under review, because there do seem to be some problems with it?
Secretary of State.
Constantly under review, Mr. Speaker, and we've shown that we're willing to change these measures to follow what works. It's an unprecedented crisis, and I welcome the support for from the Honourable Gentleman for the measures across West Yorkshire. And it's been a pleasure to work with him and to hear his voice in this chamber about what's needed. My message to his constituents in Huddersfield and across West Yorkshire is that these measures are necessary. We wouldn't have them in place unless they were, and the more that people can abide by them, the quicker we'll be able to lift them. And I look forward to working with him on supporting people in Huddersfield and across the country to keep this under control.
Now come to Jeremy Wright. Chairperson.
Thank you very much, Mr. Speaker. I recognise, of course, the value of simplicity on issues such as the curfew for the hospitality industry. But would my right honourable friend accept that we should allow economic activity where it does not cut across public health objectives? And will he therefore apply an imaginative approach to doing that? For example, looking at how we might be able to allow hotel guests to stay in hotel bars where they are resident in the hotel for longer than 10 o'clock, recognising that for some hotels they depend very substantially on that income.
Secretary of State.
I'm always happy to look at as he calls it, imaginative ideas like that. He will know that there's a tension between the clarity of the rules and some of the and bringing in additional nuances into the rules. And he'll have seen how, you know, as a society, we have struggled with that balance all the way through this because we're in novel circumstances. But I'd be very happy to talk to him about his proposal.
Mandeep Singh Desi.
Thank you very much, Mr. Speaker. The imposition of a 10 p.m. curfew on the hospitality industry was entirely avoidable, but became an inevitability because of the government's shambolic handling of its privatised test and trace system. Last month, I highlighted to the Health Secretary that locals in Slough were being forced to drive hundreds of miles, including catching a ferry to the Isle of Wight, just to access a test. But he retorted, and I quote, "On the contrary, the fact is we are working hard with the local authority in Slough." Well, Mr. Speaker, the Council have informed me that they have not heard a dicky bird from either the Health Secretary or his team, so perhaps the Health Secretary can advise us this time, when will the test centre in Slough go back to being a drive-through and walk-in test centre so that locals can actually access a test when they desperately need one?
Thank you very much, Mr. Speaker. We have got this record testing capacity, and I'm incredibly grateful for all the people who work in it to deliver it. And I will not have this divisive language. I just won't have it.
We're heading up to Amersham with Dame Turrell. Dame Turrell.
Mr. Speaker, restricting hospitality hours and venue capacity, although not ideal, can actually present us with a good opportunity to explore and support our local businesses, such as the excellent gin distillery in the village of Penn in my constituency, Griffiths Brothers, who operate a shop where you can sample their high-quality gin made from the best of the best, and in fact take it home and enjoy it at your leisure without a curfew. What can the government do to encourage people to visit these local distilleries and breweries that are a vital part of the hospitality industry, and many of whom have been having a very lean time during the pandemic?
Yes, well, Mr. Speaker, I'll do everything I can, both policy-wise and personally, to support our great distilleries, including in her part of the world. I think one of the wonderful things of the last few years has been the massive expansion in the number of local distilleries and breweries, and I'm really glad that she supports her local gin brewery, no doubt both in her official capacity and perhaps with a tipple at home.
Graham Stringley.
Through you, Mr. Speaker, can I say to the Secretary of State that I voted against him last night, not because I want the virus to rip through the country, quite the reverse. I want him to get decisions right, and I don't think he's getting them right at the present time. The 10 o'clock curfew is bad for jobs, bad for the economy, and it is not controlling the spread of the virus. There is no scientific justification that he's been able to give for this 10 o'clock curfew. I believe he would get his decisions better and more correct if he consulted the Parliament and the House of Commons in particular on these decisions, particularly on local lockdowns. Today, Merseyside is being locked down and the Merseyside MPs can't talk about it. Will he agree before taking further measures to bring every new restriction back to this House?
Secretary of State. Well, of course, the restrictions will come back to this House in the normal way. And as he well knows, yesterday we made the further commitment that all measures that are nationally significant will be brought forward for a vote before they are implemented, wherever possible. I was very pleased that, as a result of that, there was an overwhelming majority of support for the renewal of the Coronavirus Act yesterday. David Johnson.
Thank you, Mr. Speaker. I support the 10 p.m. restriction as an alternative to hospitality businesses having to be closed entirely, but it may well hurt certain sectors of hospitality more than others. For example, wet-led pubs like the Wheatsheaf in Farringdon, which don't serve food. So will he and his colleagues confirm that they'll look closely at whether certain parts of the hospitality sector are being hit hard to see if they need more support?
Yes, of course we will, and I take the point about wet-led pubs. Of course I do. What I'd say is that he puts it right that the 10 p.m. curfew is far better than closure of hospitality. Not that we want to do that, but that we do need to take measures to suppress the virus. And he's wise in his description of why we've had to take these decisions, because you can't will the ends of suppressing the virus unless you will the means, and some of the means are difficult.
Heading up to Yorkshire with Carl Turner. Carl Turner.
Thank you, Mr. Speaker. Over 6 months into this pandemic, and people in my constituency of East Hull still see no sign of the world-beating test and trace that were promised. Does the Secretary of State feel any personal responsibility for the utter chaos that is putting lives and livelihoods at risk in my constituency and across the country?
Mr. Speaker, I feel personal responsibility for the record number of tests that are being done in this country. I feel personal responsibility for the fact that the vast majority of people in Hull and across the country can get a test within 6 miles of where they live and get the test results back, the majority of them, the next day. I feel personal responsibility for that. I feel personal responsibility for the biggest contact tracing programme that this country has ever seen, with the support of the armed forces, the NHS, brilliant civil servants and the private sector working together. And I think it's that sort of coming together that we need to get through this virus.
Harriet Baldwin.
Very good. Thank you, Mr. Speaker, and thank the Secretary of State for another update on COVID-19. But I'm wearing pink, Mr. Speaker, because October is Breast Cancer Awareness Month. So can the Secretary of State take this opportunity to remind everybody because 1,000 women will die of this disease this month alone, of the importance of checking for symptoms, seeing your GP if you have symptoms, and telling the NHS how important it is that the screening programmes get back underway.
Yes, I strongly agree with my honourable friend. If you must check and continue to check, and if you think that you are at risk of cancer or have found a lump, then please come forward, because the NHS is open, and help us to help you. And I'd also say this, that the more that we can suppress the virus and keep coronavirus out of our hospitals, the easier it will be to treat more people for cancer and to make sure that that screening stays open. So efforts to tackle the virus and to stop the spread of the virus directly save lives from cancer, and we need to get that message out as well.
We have 15 withdrawn, so we're going to Sir Desmond Swain.
A national curfew in the New Forest is rather unfair given our very low infection rate, and restaurateurs and landlords have invested a great deal in COVID-secure measures and reduced capacity, and the loss of the extra hour reduces the throughput, particularly if you want a second sitting to come through for dinner. It makes it very uneconomic. So will you consider this as a possibility? Devolving the power to impose curfew locally, even to particular establishments. And that would provide a powerful incentive on landlords to ensure that their patrons behaved sensibly and properly.
Well, Mr. Speaker, I welcome my right honourable friend's constructive suggestion. As we constantly have these policies under review, it's that sort of working together that will help us to improve the response. Of course, I understand the impact on the New Forest. I love some of the finest pubs in the country outside of West Suffolk are in the New Forest, it is and so we should keep this under review, because the whole point is to suppress the virus whilst doing the minimum negative impact on the economy, and it's that second part that we're mostly discussing today.
I go to Greater Manchester with Afzal Khan. Afzal Khan.
Thank you, Mr. Speaker. Many of the hospitality businesses in my constituency have been deeply upset by the imposition of the 10 p.m. curfew. Overdraft, a bar in my constituency, told Levenshulme News that they feel this is a knee-jerk reaction by the government to counteract their own poor handling of the virus. And they are punishing a sector that has reacted seriously, flexibly, and efficiently over the past 6 months. What would the minister say to businesses such as Overdraft who feel let down by this government's decision-making?
What I'd say is that we do what is necessary because it saves lives, and we understand the impact that it has. And the message I'd say to everybody in Bradford is that the more that they follow the rules that are in place, the faster we'll be able to get through this.
Thank
you, Mr. Speaker. Mr. Speaker, it does seem strange to think that concentrating trade in a smaller number of hours and making everyone leave a pub or a restaurant at the same time, rather than spacing them out over the course of the evening, should suppress rather than spread the virus. So would the Secretary of State summarise the scientific advice that he's had on this point?
The scientific advice is that the people who are closer together are more likely to spread the virus, and later at night, social distancing becomes harder. And we've all seen the pictures of people leaving pubs at 10 o'clock, but otherwise they would have been inside the establishments, and we all know that outside is safer, or they'd be leaving later. So, of course, we keep this under review, and of course we are constantly looking for how we can improve these policies. But I think we've got to look at both sides of the evidence to try to get this right.
Withdrawn, Mike Wood.
Thank you, Mr. Speaker. People will only believe that the 10 p.m. curfew is the least bad option if they understand the basis on which the decision was taken. The figures for number of infections linked to hospitality range from the 3% that PHE have put for outbreaks up to nearly a quarter that the Deputy Chief Medical Officer has suggested. Will my right honourable friend make sure that the evidence as to how many transmissions are linked to pubs and hospitality based on test and trace data is available so people can reach their own conclusions?
Secretary of State. Yes, and the evidence which we're publishing, updated evidence today, shows that just under a quarter figure is correct. It is the highest single identified area. The figures on outbreaks, which were also mentioned by the honourable lady opposite, is measuring something completely different and is not a measure of how many cases are caught there. The 25% figure is, of course, for those who catch it outside the household. The single biggest place you can catch coronavirus is from somebody else inside your own household, but that is, in a sense, inevitable and very, very difficult to prevent.
Heading up to Gateshead with Ian Mearns. Ian Mearns.
Very grateful, Mr. Speaker. Mr. Speaker, the tighter restrictions here in the North East are already having a severe impact on many businesses who've been left without appropriate financial support. And whilst it's imperative that we prevent the further spread of coronavirus, it's also important that we protect businesses, workers, livelihoods and jobs. The arbitrary 10 p.m. curfew has increased the financial pressure on many local hospitality businesses and appears to have had the effect of inadvertently encouraging unregulated gatherings after the blanket 10 p.m. closing. Wouldn't it be safer for those who are allowed to be seated in a safe, regulated premises, adhering to social distancing after 10 p.m, rather than on the streets or on public transport with significant numbers of other revellers who may have a reduced inhibition or levels of self-control? And those businesses who are responsibly operating at much reduced capacity, adhering to the regulations, are provided with the urgent financial support as requested by the local authority leaders here to ensure that it is at least equally viable for them to remain open for business rather than close completely, possibly for good.
Secretary of State. Thank you very much. Well, we have put extra financial support into the North East, and I want to thank people across the North East for what they're doing to stick by the renewed and increased restrictions that we had to put in place earlier this week. The point that he makes about people's reduced inhibitions later at night is the critical one, and as I just mentioned to my right honourable friend, the chair of the Science Select Committee, it is almost certainly true. It's one of the few things we know about this virus with great certainty that transmission is much lower outside rather than inside, and that also helps with protecting people against this virus.
Thank you, Mr. Speaker. My Eastbourne constituency thrives on hospitality. Many jobs are dependent on it. It's also low incidence when it comes to the virus, high compliance when it comes to the safety measures around being COVID secure. My right honourable friend said in his opening remarks, the second peak is highly localised. So in that light, can I ask him how quickly we can look to move to a more localised regional approach to the 10 p.m. curfew?
Well, we are taking a more localised approach to tackling this second peak than the first. For two reasons. The first is that the evidence is that it is much more localised in where the virus is concentrated. And the second is that we know far more about where the virus is concentrated. But that extra information also tells us that the number of transmissions are much higher in hospitality than in many other settings, for instance, than compared to workplaces. Hence, we've made the decision that we have. But the core of the point that she makes, which is that it's safer in places like Eastbourne because there are fewer transmissions, is a reasonable one as we keep all of this under review.
We're heading and returning to Hull with Emma Hardy. Emma Hardy.
Thank you, Mr. Speaker. Last week I spoke to a lady whose husband has dementia. He was in a care home and she was unable to visit him, and he deteriorated rapidly until he became deemed a risk to himself and others and was eventually sectioned. When he was sectioned, she was then allowed to visit him. I do, of course, completely understand the difficult balance that the Minister must make between protecting our health and the health of others, but I ask if he could please look specifically What guidance can be given for visitation rights to visit loved ones who have dementia?
Secretary of State.
The Honourable Lady makes an incredibly heartrending and important point, and the balance to strike in terms of the rules around visiting those in care homes is one of the most difficult. On this, I rely heavily on the clinical evidence of Jenny Harries, the Deputy Chief Medical Officer, who works with the other 4 nations to try to make sure that we get this balance right. It is very difficult, and the guidance that we put out includes the permissive ability to allow Directors of Public Health to take decisions that are appropriate in local circumstances. But it is a very, very difficult consequence of this virus.
Greg Smith.
Thank you, Mr. Speaker. As I've spoken to landlords and landladies around my constituency, they've all been incredibly grateful for the unprecedented support that the government has provided them, but they have been equally clear that that just about kept their heads above water, especially at a time when there was warmer weather. I very much welcome my right honourable friend's commitment to keep this under review, but what reassurances can he give landlords and landladies that as we head up towards Christmas and the nights get colder, that there is a timescale on this and that they can have hope that they will be still trading at Christmas and not sadly closing down for Christmas?
Well, the truth is that the more we all avoid close social contact, the harder the virus will find it to spread, and the easier it will be to lift measures. It's as straightforward as that. But from that logic, obviously, comes many difficult consequences, including the ones that he speaks to. But I'm very happy to keep talking to my honourable friend to make sure that in his area and across the country we get this balance right.
25 withdrawn. Sarah Dines.
Thank you, Mr. Speaker. I thank my right honourable friend for his updates, which are always very useful. Can I ask him to think for a minute about places of low infection rates like the Derbyshire Dales? We have some fantastic wedding venues like Shuttle Hall and Eam Hall, and we have some great historic pubs that have been around for hundreds of years, like the Ratland Arms and the Peacock at Roseley. Pubs like the Devonshire Arms Baslow and the Old Dog at Thorpe. Can my right honourable friend consider opening locally early where people can prove good compliance and there are very low infection rates, because we have to allow the economy to get up and running again?
Yes, she's absolutely right about to support her local pubs and also in what she said at the end about keeping the economy going whilst we deal with this problem. She's also right that there are large swathes of the country with very low infection rates, including Derbyshire and other parts. And our approach is to take as minimum national action as necessary to ensure that the rates do stay low in Derbyshire and in the areas where it's low, whilst also, of course, taking more action in places where the virus is rife. And that's an approach that we'll be strengthening over the weeks to come.
27 withdrawn, so we'll head to Cole McCartney in Lincoln. Cole McCartney.
Good morning, Speaker. Whilst I'm sure there is some logic behind the recent 10 p.m. curfew, other changes also put in place, including table service, has led to small hospitality businesses, such as the Treaty of Commerce pub in my constituency on Lincoln's High Street, having to increase staffing overheads, which they can currently ill afford. Will my right honourable friend acknowledge that the latest changes in guidance are not entirely suitable for all businesses? And I have heard what he said this morning, but can he commit to reviewing these regulations regularly and at the earliest opportunity to ensure we protect jobs, the wider economy, and the important freedoms of businesses and individuals, but also remain COVID secure?
Secretary of State.
100%. I think my honourable friend speaks with great wisdom.
Alan Brown.
Thank you, Mr. Speaker. Mr. Speaker, I've been known to enjoy pubs and hospitality myself, but the reality is, if this sector is to survive, in particular the nightclubs and entertainment industry, then they're going to need much bigger government support. Does the Health Secretary accept that, and is he having these discussions with the Chancellor? And also, does he accept that if Scotland wants to go its own way in terms of a different level of curfew, then the Scottish Government needs to have, at the very minimum, borrowing power so that it can make changes for public health benefits, but also provide the necessary support for these businesses?
Well, as he knows, while of course public health measures are devolved, It's only because we're one United Kingdom that we're able to have the strength of support that's in place right across Scotland. And so I think that he and his party would do well to recognise that and to welcome the support that the UK has been able to provide into Scotland in these very difficult times.
Fiona Davison.
Thank you, Mr. Speaker. When my right honourable friend visited Bishop Auckland during the election, we spent our campaigning lunch break in a pub called the Merry Monk. And since then, I've been in regular contact with the landlord, Christian Burns. Christian, alongside a lot of other pub landlords, has actually written to the Prime Minister expressing their concerns about some of the lockdown measures that have been introduced. And whilst I recognise and really welcome the unprecedented support the government has put in place, more than £190 billion, this is not small fry. Can my right honourable friend please confirm that to Christian and other landlords that ministers will continue to work with the hospitality industry, particularly pubs, because as we know, we need to save our pubs. They're a lifeline for our local communities.
Absolutely right. I really enjoyed my trip to the Merry Monk with her. We left before 10 p.m, Mr. Speaker, even though at that time we could have stayed longer. Of course, we'll keep working with the hospitality industry, and I wish all the pubs in Bishop Auckland all the very best, and we will support them as much as we can.
Thank you very much, Mr. Speaker. We are in a never-ending cycle of repeated lockdowns that are deferring the problem because they are not matched by robust testing and clear messaging. It's very clear from the Health Secretary's responses this AM that the 10 p.m. curfew is yet another example of the Prime Minister plucking ideas out of the air to be seen to be doing something. It's already caused significant damage to the hospitality industry and, as predicted, is doing nothing to help stop the spread of the virus. When will this government start to understand that a balance needs to be struck to protect those most at risk without complete societal shutdown?
Mr. Speaker, I would urge the Honourable Lady to support her constituents and the public health measures that are necessary in order to get this virus under control, in order to protect this country, to protect her constituents and to save lives.
Lee Anderson.
Thank you, Mr. Speaker. Pubs like the New Cross in Ashfield, run by Jay and Matthew, are losing revenue due to the 10 p.m. curfew. They fully understand the rules that need to be in place to keep us safe. So can my right honourable friend please explain to the staff and regulars at the New Cross how science has guided the decision to close pubs at 10 p.m.
I want to say to all of the staff, all the regulars at the New Cross, I want to say we wouldn't have this in place unless we thought it was needed. The science is about how late at night people end up closer together and therefore spread the virus more. And this won't stay in place 1 minute longer than it needs to be.
We're heading down to Swansea with Garand Davies. Garand Davies.
Mr. Speaker, if the government decides to restrict trade or close down trade for pubs or particular businesses for good public health reasons, surely it's for all of us through the government to pay that cost through borrowing at historically low interest rates, paid back over time through our progressive tax system, and not for individual pubs and businesses to have to pay that cost, possibly with bankruptcy, places like Brains Brewery in South Wales, indeed. And so therefore, will he have a word with the Chancellor to ask that he provides adequate financial support for both sustainable businesses and good public health?
Thank you, Mr. Speaker. Of course, this measure is for England, and it's up to the devolved Welsh administration to decide public health measures in Wales. But the principle that we as taxpayers, as a whole country, should shoulder as much of the economic burden as is possible that principle is what underpins the absolutely unprecedented £190 billion of extra support that this government has put into the economy to get us through these very difficult times.
Thank you, Mr. Speaker. This week, Burnley recorded the highest COVID-19 rate in England, and that's understandably caused concern to residents who are worried not just about the virus, but about the impact on the local economy too. So could he reassure them and me that when we look at further interventions that may be needed, we'll keep them as targeted as possible so we can fight the virus where it is really spreading?
Absolutely. There is a lot of virus in spreading in Burnley, and we need to all come together to tackle that spread. I know that my honourable friend has been fighting as hard as possible for the people of Burnley, and making this argument to me in private as well as in public, that we need to make sure the measures are as targeted as possible, have as low a negative impact as possible, but we do need to get the virus under control in Burnley and across the country, and I pay tribute to him for the work that he's doing in support and representing his constituents.
Ed Dugan. Thank you, Mr. Speaker. The Minister will know that the hospitality sector emerged on its knees from the general lockdown, and I'm sure he understands that they were barely getting to their feet when the 10 o'clock curfew came in. He has given honourable and right honourable members a lot of assurance today that he will keep this under review. As part of that review, can he assure the licensed trade, particularly those that are relying on wet sales, that he will take a view on staggered exiting and a more intelligence-led curfew, appreciating that the curfew has value to add, and can he take a look also at the role of off-sales in promoting community transmission, not in the hospitality sector?
Well, of course, we look at all these things. This, of course, is a measure in England, and it's because the UK government has put in £190 billion across the whole UK that we've been able to give the support that we have, but we keep that under review too.
Come on.
Thank you very much, Mr. Speaker. There is no constituency in the country that has such a high concentration of first-rate pubs than Ipswich. And currently also in Ipswich we have very low levels of COVID-19. Last weekend I spoke to the landlord of the Belstead Arms in Chantry, who had to watch as many of his loyal customers who would have been spending hundreds of pounds in his pub, supporting that pub recover from the previous lockdown, went to the off-licence across the street to buy beer from there. Will my right friend assure me that at the closest possible time he will review measures and make sure that pubs in Ipswich can stay open later?
Yes, I know the Belstead in Chantry well from campaigning pit stops. And it is true that Suffolk has the finest pubs in the country. And my honourable friend is making his case for Ipswich very strongly. Of course, we keep these things under review, and we'll lift these measures as soon as we can.
Heading to South Wales to Ruth Jones. Ruth Jones.
Thank you, Mr. Speaker. I've spoken to many business owners and residents across Newport West in the last few days, and there's increasing concern that the UK government's left hand doesn't know what the right hand is doing. The border between Wales and England is extremely porous, and any differences in local lockdown rules and restrictions are confusing for those living along it. So can the Secretary of State outline exactly how and how often he is meeting with members of the devolved administrations to ensure all parts of the UK are involved and engaged as we chart our way through this crisis?
Constantly is the answer. I was brought up on the Welsh border in Cheshire. I know exactly how porous the border is. Of course, public health is devolved, unless she's going to argue against the devolution of health powers, which I'd be surprised at. In fact, I've received a text from my Welsh opposite number during this session. So it is we have a constant conversation and dialogue to try to minimise exactly the sorts of issues that she talks about.
38 withdrawn. Zarasulta.
Thank you, Mr. Speaker. Public health must be our first priority, but new restrictions on pubs, bars and restaurants need to be accompanied by new economic support for workers and businesses. Otherwise, people will be pushed into unemployment and destitution, and businesses will be forced into bankruptcy. So on behalf of hospitality workers and businesses in Country South, can I urge the Secretary of State to speak with his Cabinet colleagues and bring forward new measures that will support livelihoods and businesses and actually save jobs?
Well, yes, the £190 billion of extra funding has been there to support jobs, and of course we keep that, as with all these things, under review.
Jane Hunt.
Thank you, Mr. Speaker. I refer colleagues to my register of interests. I understand and support the measures taken to reduce deaths from this terrible disease, and indeed thank ministers for all they've done to stem the tide of this virus. Please could my right honourable friend consider allowing pubs, cafes, restaurants and casinos to extend their closing time where customers are still in the process of eating a hot meal. This would allow time for a second sitting at these venues without disturbing the safety element of table service and social distancing. It would also mean a staggered time of exit from these venues, allowing better social distancing in the local community.
Well, thank you very much, Mr. Speaker. Of course, as we keep this under review, we'll consider all the options. But the clarity of the rule that was brought in was one of the reasons that it commends itself. But I'd be very happy to talk to my honourable friend about the future.
Morris.
I'm grateful, Mr. Speaker. We all agree that suppressing the virus is essential in saving lives. And as a scientific socialist, I think we should apply basic public health principles. It seems absolutely clear to me that it's problematic that we have a 10 o'clock curfew when large numbers of people are all coming out in the street at the same time. Can I just point out to the Secretary, the nighttime entertainment businesses, such as comedy and live music, many of which are based in COVID-secure premises, such as pubs and clubs, are seriously impacted. And like he did with the members from...
Come on, Secretary. We've got a grip.
I love comedy. I love live music, and I wish that we didn't have to do this. But I've answered the point about outside being safer than inside, and it's one of the many regrets of the very serious problem that we've got.
Thank you, Mr. Speaker. I represent a central London constituency where many businesses are hurting hard, especially with the 10 p.m. lockdown. I also have many residents who work late hours, so are only going out for the first time at 8:30 or 9, so don't fit into the idea of going to the pub at 6 o'clock. Can my right honourable friend assure me that he will review these measures at the earliest opportunity?
We will keep these measures always under review.
To Toby Perkins in Chesterfield. Toby Perkins.
Thank you very much, Mr. Speaker. I accept what the Secretary of State has said about the science, but he must realise that there were many publicans who were really struggling to get by before this. The new things that are put in have just made their businesses untenable. So does he accept that getting support for the measures that he's put in place has to come with a financial package that supports our publicans to still be open after COVID?
Well, yes, I've addressed this point. We have put £190 billion in, and we keep all that under review.
Nicky Aitken.
Thank you, Mr. Speaker. Love it or hate it, the gambling industry delivers thousands of jobs and tax to this country. Casinos in particular create 60% of their business after 10 o'clock, and it is illegal to gamble if you are drunk. Can I therefore ask the Secretary of State if he will consider whether casinos can continue to do business after 10 o'clock in England as they are in Scotland?
Thursday. I'd be happy to talk to my honourable friend about that.
John Morrow.
Thank you, Mr. Speaker. Newcastle's nighttime economy is globally renowned, but yesterday, in a typically cowardly attack, the Prime Minister basically said that we shouldn't complain about the impact of these measures on that sector because local leaders had asked for them. So will he confirm that in their letter of the 29th of September, local leaders specifically said that these measures must be accompanied by targeted support, and will he say what targeted support pubs and restaurants and the 10,000 jobs in my constituency that depend on them can expect?
Thursday. Yes, the leaders of the Newcastle 7 councils, Newcastle Gateshead and the wider North East councils, did ask for the measures that were put in place. We put in £10 million of funding, and the most important message that we can get across to people across the North East, where the case rate continues to rise, is that the more that people follow the restrictions, the quicker we can ease them.
Heading to Darlington, Peter Gibson.
Thank you, Mr. Speaker. Recognising the need to control the virus with the 10 p.m. curfew, can my right honourable friend outline what additional guidance and support has been offered to our hard-working police officers, like those in Durham Constabulary who serve my constituency, to help them protect the public after 10 p.m?
Well, this is, of course, a matter for the Home Secretary, but there has been additional guidance to the police, and I pay tribute to the police who have done so much work to enforce these rules, and they continue to step that up.
We're going to Scotland with Steve Bonner. Steve Bonner.
Thank you, Mr. Speaker.
To ask the Minister to what extent he thinks the likes of Dominic Cummings' clear disregard of the rules during lockdown has undermined people's compliance with the current guidance. This is placing excess pressure on police as well as staff in the hospitality sectors. And to also ask if he agrees with me that as many of those on the front line of the fight against COVID are now paying the heavy price for Cummings' actions.
Secretary of State.
I don't recognise the link at all.
Andrew Jones.
Thank you, Mr. Speaker. Restrictions curbing when we can go to the pub is against the DNA of our country, but we are in exceptional times, and I recognise that includes taking measures which people don't like and which ministers don't like having to introduce. So will my right honourable friend commit to keeping the restrictions under the closest possible review and in place for the shortest time necessary to protect lives?
I absolutely agree with my honourable friend who speaks from the heart.
49 withdrawn, so we're going to Peter Byrne in the final question. Peter Byrne.
Thank you, Mr. Speaker. The Secretary of State has heard from across the House great concerns about the 10 p.m. curfew. And given the statement yesterday from yourself, sir, and also from the Secretary of State about more parliamentary scrutiny, does the Secretary of State agree that if the 10 p.m. curfew had not yet been brought in, this is exactly the sort of measure that should be brought to Parliament first, scrutinised, debated, amended if necessary, and voted upon? Does he agree that that's the sort of thing we can expect in the future?
Secretary of State.
I do agree. I'm glad to agree with my honourable friend that we have brought in a new, I've announced yesterday, a new process, an innovation on parliamentary procedure to ensure that there are votes on nationally significant measures in the future.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I'm suspending the House for 3 minutes. Order.